All right, today we're going to talk about myths and facts about lower back pain. My name is Tom Willemann, physical therapist, spine specialist. I am here to tell you there's a lot of things out there that people are saying and are really not true. They're really myths. And there's a lot of facts that you should know about so you can make a better decision for your health. A tremendous number of people experience back pain in their lifetime, about 80%. I mean, I'm sure you know tons of people that have, but there's a lot of things that are not correct that's being said, and it's actually making and delaying healing sometimes, and also delaying you getting appropriate care. And at the end, if you stay tuned, you're going to get my 2 top back exercises that'll help you if you're having trouble kind of getting back to the activities you want to. But stay tuned for the myths and facts. One of the myths is that you have to stand up completely straight. You have to be completely straight when you're sitting or standing. We want you to kind of adopt different positions. I always show people using a roll, and I'll set up people in their car with proper lumbar support. But when I can, I like to have someone that's constantly moving or fidgeting. I like my ADD people that are kind of moving and changing position. They can kind of slouch, they can lean over, they can side shift, they can stand up. All a variety of positions are much better. The back and the body does not want to be in one position too long. So yes, it's good to sit up and tall. That's supposed to be, the right spinal position. But moving and changing position is probably the most important. When we can't, obviously using a lumbar roll and sitting, or when we're driving our car, can be helpful for certain people with back problems. But not all. It really should feel better. What I will tell you is I like to have people, in most cases, if they're really having a significant back episode, I want them getting up between 10 and 20 minutes, move around, set a timer, and move around. But sitting up absolutely straight sometimes is worse. And just feeling like you have to maintain action makes you feel more stiff and you may experience more pain. So keep that in mind. Another myth is that bed rest. You got to rest. You got to take you got to take it easy. You can't move. Especially bed rest is not good for people that have back pain. After 2 or 3 days of bed rest, they actually find that people do worse. If they continue to stay in bed because they want to protect it and let it heal, they actually do worse long term. It takes them longer to heal, longer to get back to the things that they like. And one of the things that is interesting is within 2 to 3 days, in our body, we have decreases in bone density, decreases in cardiovascular function, decreases in general GI function. All these things start slowing down when we shut down and rest. So we do want to get moving a little bit, as long as it doesn't make our condition feel worse. And having a little bit of a pain when we're getting up and moving and going for, let's say, a minute or 2-minute walk or 5-minute walk, a little bit's okay as long as it doesn't make your condition worse. So complete bed rest, not so good. Get moving as tolerated. Wow, shouldn't lift heavy things. Yes, sometimes you do have those people that come in, they've lifted a heavy thing. Normally it's a heavy thing that they weren't ready to lift. They took a big jump in their workouts, they started taking a big jump in maybe the amount they deadlift or squat. But just lifting heavy things is relative. What I lift is heavy as compared to someone else that's lifting something. It varies, okay? But just the sheer fact that you're lifting heavy things does not mean that you're guaranteed that you're going to develop pain and lower back pain. Lifting with good mechanics, being warmed up, a proper sequence, a proper progression of weight training, being guided by a therapist or a trainer, you can lift heavy things, but we have to look at certain things that are higher risk, okay? But it isn't a guarantee that you're going to have trouble. If anything, I want you to progressively get stronger so to decrease the chance of you having trouble with a load, with a heavy book bag, with cleaning out your garage. We want you to start lifting to get a resilience for activities that you do every day. A lot of people don't realize I was just down in Maryland the other weekend, and I was holding these gasoline jugs, and they were each weighed about 35 pounds each. I had about one on each side of me. I lift so I can do things like that and not get injured. If I'd never lifted heavy things, I would never be able to do those things. And yes, I'm at a greater risk of injuring myself. It could be hip, back, knee, whatever, for anything. So keep that in mind. I like to have people start strength training so they can lift heavy things and develop resiliency. You got to sit on a firm mattress. You just have to sleep on a firm mattress. You have to sleep on the floor. You need something firm for your back. That isn't necessarily the right formula for everyone. Think of it this way. We have people that are, 90, 100 pounds. Then we have someone that's 250. Do they both need the same bed? So that's why some of the beds that have varying levels of support are better. Across the board, the Journal of Chiropractic did a study, and they found kind of medium firm, like not really firm, medium firm mattresses across the board are better tolerated and better for people recovering from back pain. But it doesn't mean that we shouldn't have that we should just guarantee firm mattress means better recovery, or we decrease the chance of having back pain. So keep that in mind. Some of the Sleep Number, some of those other beds can kind of personalize it for your type of body. You may have wider hips. You may have shorter waistline. Your anatomy might be different from someone else. So we can't say absolutely that we need this one mattress. All firm is the key to guaranteeing no pain or recovering from a back episode. Listen, no one wants to hear it, but being overweight and having extra weight will put more pressure on your back. People say sometimes, if I lose some weight, will get rid of some of this back pain. Sometimes it could probably help it. The irony is, I think losing some body weight will help you with other systems of your body too, and you generally have more of a healthy lifestyle. But it doesn't mean if you're skinny that you're not going to develop any kind of lower back pain or have episodes. It's not a guarantee, but generally there's a little higher risk, more weight, more chance of back problems. It's just more weight on your skeleton. All right, so keep that in mind if you can. It's good for a variety of other things as far as a good healthy body weight. Okay. Some of our weightlifters, people like that, they'll look at BMI and how much weight they have. Sometimes they're a little skewed. They look, being strong is very different from being overweight, and especially for males that carry the weight more in the center over the organs, and that can really affect function and potentially affect your back. The fact is, if you do an MRI or an X-ray, particularly an MRI, and you see bulging discs, that is very normal. There's a lot of people that have those, and they've done tons of studies in people with MRIs that have no back pain. And they found out that 60, 80%, there's varying percentages. I'm not even going to quote. There's a lot of people that have bulging discs or herniations in MRIs. In people that have never had a trauma or a history of back problems or current back problems. So don't get nervous about the fact that you have a herniated disc or a bulging disc on your MRI or even arthritis. A lot of people have these findings and don't have back pain. It's also just part of the clinical picture. The MRI and X-rays are good. They're a source of information, but realize your movements, how this problem started, your history with back problems, all these other factors we have to weigh into it before we pick out an exercise that's best for you. What's the next level of treatment? So if you get these in an MRI and you're concerned and you see that people get nervous, and they actually find that we do MRIs too early. Let's say you just had back pain for a couple weeks, you're nervous. You tell your doctor, I got to find out what's going on, and they order an MRI. A lot of times those people do worse because they typically find something that's wrong in your back. When I say wrong, kind of wear and tear in the lower back, and that can be in the form of arthritis, some changes in disc height, herniations, like all those things can be found. So wait a little while. Obviously, if you have what they call hard neurological signs, which means you're developing progressive weakness, you're having bowel bladder changes, you're having horrific pain, night pain, maybe there's a reason to get those MRIs earlier, but you don't want to jump to it. Typically at 6 to 8 weeks, they'll decide. So why 6 to 8 weeks is an important time frame is a lot of back pain just spontaneously gets better. Whether you went to me or a doctor or anyone, the passage of time, you will heal. Unfortunately, there's a good percentage of people that's in that smaller percentage, let's say 10 to 20%, that become chronic. And those are the ones we worry about. We want to really get them going. They become our surgical cases. So we want to make sure we take a proactive approach as far as healing, even a little education on what things not to do, what things to do, and not to scare people. Back problems are very common, but are often, even though they're very severe, are not serious. It's not a sign of a tumor or of infection. Very small percentage of those folks, that's the origin of the problem. And often with the MRIs, they don't tell us the source. Like everyone wants to know, is it a muscle? Is it a ligament? Very hard to categorize when you go in for your back problem that you have a ligamentous problem, you have a muscle problem, you have a disc problem. It is hard to identify that oftentimes. Oftentimes it's very hard for professionals to really truly give you an anatomical source for your pain. So keep that in mind. There was a great orthopedist that I can't remember his name right now, but he used to say, sometimes in medicine we're distracting the patient until the body is allowed to heal. And I think some of our treatments there's a fair amount of placebo that are involved with medicine. The ultrasound treatments, the electric stim, the moist heat. I'm not saying all the time. There's times that you use these different modalities. But a lot of times they're really not getting to the source of the problem. And I think they're distracting them somewhat on the path to getting better. In fact, sometimes I think we have to be careful as therapists and doctors that we don't overtreat and we don't aggressively treat these conditions, and we want to let that body heal. Arm the person with facts, educate, and so they understand that make the best decisions and not try to scare them into treatment and passive treatments and make them dependent. What we don't want is a dependent patient. And I think there's an overutilization of some of these approaches to treatment that are making the patients very dependent, and they're all not going to speed the healing. They may decrease spasm, they may make you more comfortable, which is fine, but realize they're not getting to the source. They're not accelerating the healing most times. Okay, keep that in mind. Another big one is a lot of people say this inflammation. There must be inflammation, and inflammation is just the body's desire or efforts to kind of get some cells in there, clean up some tissue that's been damaged, and repair it. But not all the time is inflammation the source of your back pain. And you'll notice that sometimes when people they'll take Advil, which is an over-the-counter, or ibuprofen in generic form, or they'll get an injection, a steroid injection, all aimed to reduce inflammation. And interestingly, sometimes those people don't do well. What they really need is some flexibility. They need a little bit more strength. They need a little bit more endurance. And they also have to find out what's triggering the back pain. They might be doing an activity that's triggering it. We're just trying to set the best environment, and they call that mechanical back pain. And that's really what the exercise at the end are going to show you, is people that have loss of motion. If motion is really what's the origin of the problem, you're going to address that, okay? And hopefully we'll make that accelerate and decrease the chance of you getting stiff and deconditioned. But realize not everything in lower back is related to inflammation. That's why those anti-inflammatories don't work. So keep that in mind when you're popping that Advil. It's not really changing. Try it without the Advil. You may not be getting any benefit from the Advil. It's very easy. If it's really helping you and it is inflammation, then resume when you're allowed to. But keep that in mind, and maybe you may have to take a slightly different approach to the problem. So if you're physically active, are you guaranteed that you're not going to get back pain? If you keep moving, are you an athlete and all that? Which is good. You're healthier, obviously, healthier than the person that's completely sedentary, that doesn't engage in an active lifestyle, whether it be gardening, walking, CrossFit, tennis. But it doesn't guarantee that you're not going to, have problems. Some of my athletes, they work out very intensely at night, or they have a morning program, and then they sit for 8 hours in a day. Unfortunately, that sitting is probably one of the big triggers, one position too long, for several types of back episodes. You'll see that that'll be the big trigger. I just had a friend of mine that came back from the shore, Jersey Shore, and he was in the car an extra long, and it was in for 4 hours. Horrible traffic. And that's what triggered his back pain. I've had people come back from skiing. The trigger was sitting and not moving for periods of time. Not so much like we talked about lifting something heavy or awkward. So realize, it's good that you're physically active, but creating that movement throughout the day, like we talked about, changing position, standing. I like the standing desk where you can stand, and I also like you to sit down too and vary your position. That fidgety approach to a little bit of movement throughout the day is better than shutting down. So it doesn't guarantee. I'm glad you're doing it. You're a healthier individual overall. But if we can figure out little strategies during the day, especially if you've had a previous episode of back pain, they show that it's a higher likelihood of it coming back than the general population. So if you had it, it's probably going to come back. So what do we do? Let's get into a healthy habit called spinal hygiene of moving a little bit throughout the day and work on these strategies to kind of move. I'm very lucky. I have a job where I'm constantly sitting, standing, moving, changing, moving. I really think it's helped me as far as my back. Can't absolutely say it, but I think that activity is much better than static sitting for long periods. So keep that in mind. Keep physically active, but figure out strategies during the day that you can incorporate. And also on those long drives to the shore, maybe you got to break it up with a couple breaks if you're having trouble. Hope that helps you out. Another fact, before we show the exercises, do large herniations heal? In fact, the larger the herniations, when they're really big, those actually heal. And they've done MRIs on people that have had back pain, and these large herniations that are resting on nerves, they're just real nasty ones. And after a year, they find that they kind of resolve. They go away. and they don't know quite why it occurs. They think it's almost like the body's looking at it as a foreign object and attacking it and breaking it down over time. So a lot of these things will disappear, especially the larger ones. The smaller ones are not as often resolved independently. But it's interesting, and those larger ones that you think, oh gosh, I need surgery, I need a shot, they actually go away after a period of time. But obviously a year is a long period of time. If that's the source of the problem, maybe you need something to kind of help it along. But realize larger herniation doesn't necessarily mean a poorer outcome. It might mean you need a little time. The hardest thing is, can we wait that year? That's a long time we're having back pain. So, but keep that in mind. It's not a sentence, and a lot of people have some of these, and it's not necessarily symptomatic or giving them trouble. Okay, so keep that in mind. Okay, go ahead. So the first exercise, we call it a prone press up or prone prop. Okay, the first one is a prop. You're going to take your hands like so. You're going to lean forward, and you're going to prop up just for a couple seconds, 1 or 2 seconds. And then you're going to come back down. All right, all the way up, a little prop. You should feel a little arch in your lower back, especially if you feel like you can't stand up straight. This one may really help you especially. The second progression, this is the first one, is to go into a full prone press up. So this is kind of phase 1, phase 2 of the same exercise. So you put your hands underneath your the front of your shoulders. You want to let your arms push you up as much as you can. You want to press up. You may feel a little bit of pain at the end. Pause and come back down. Don't let the lower back muscles lift you up. It's all the arms. So you're trying to slowly kind of creep up, get a little more range of motion, pressure on, and then pressure off. You've got to get to the very end of the motion as you do the stretch. These exercises should never make your back pain worse. If you're unsure, you can do about 5 or 10, then stand up, move around, see how you feel, and see how it goes. Typically, we'll tell people to do this 10 times every 2 hours over the course of the day, and limit our sitting, and just keep active like we talked on some of the earlier things. Keep moving a little bit throughout the day so you're moving as much as you can. That doesn't increase your pain. If you do these exercises and you feel like you're having more back pain or you start developing leg pain, this is not the right exercise for your back. I like to give these out, but these are the most common ones, but it doesn't necessarily mean it's the solution to your problem. So this is called the prone prop, and then the second part of this exercise is the prone press up. Remember, never should make it feel worse. Second one, I'll show you in a second in standing. The second one, most common exercise that we give is lumbar extension in standing. Okay, so I like to have my feet a little wider than my hips, maybe a little toed out. I'm just trying to show you from a side view here. Place your hands like so, and you're simply going to lean backwards. Pressure on and pressure off. Some people start, they're like, wow, I can't quite get past this point. And then as they do it, they start noticing, wow, I'm going further, I'm going further. That's always a good sign. If you have lower back pain and you start this exercise, let's say you have just pain in this area right here, and it starts going into your buttock and going down, that's a sign you want to stop this exercise. Same idea, if that occurs when you're doing the prone prop and prone press up, that first and second phase, you want to stop these exercises. You know, on YouTube, we talk about all these things are supposed to be good for back pain. It may not match. You really need is a good physical therapy evaluation to make sure we have the right exercise for your back. But these are pretty common. If it makes you feel better, that's great. So, all right, so hands like so, lean back, pressure on, pressure off. After 2 or 3 days, if you don't notice a difference, one of those 2 exercises, you probably need a good evaluation or just time. Sometimes doing those actually make it worse. Take some time, I call it clear the deck. Don't do those stretches. If you are going to try these stretches, just do these. Don't do, let's say, another stretch you saw on YouTube or whatever else. Just keep it just to these 2 series to work on lumbar extension. They think a lot of these work or feel better is because a lot of us were sitting all times, and we tend to lose that range of motion. We tend to get a flattened back. And the reason why we correct it by doing this arch, you know, because a lot of us are sedentary or sitting more. So they think we're just correcting that, and that's the origin of the pain. It's that loss of motion. So that's why we think these particular exercises are more commonly, people more commonly benefit from it. Listen, I hope this helped you out. Any questions, just place it in the comments. Please share this video for anyone that's concerned or is nervous about their back. And keep us in mind if you need any kind of physical therapy, you can make an appointment with our clinic in Promise. Okay, have a great day.